Good evening, everyone. You are all welcome, and I'm so excited to have you all on this call. Kindly drop it in the chat box where you are watching me from. Mrs. Adewale Monsurat, thank you for joining this call. Mrs. Fatiat, Mrs. Ajike, Miss Ma'am Osna Designs, Juliana. Everybody, thank you all for joining me on this call. And I so much appreciate you. So without further ado, we'll be starting now. So welcome once again. I want to take this moment to appreciate everyone who has shared this webinar link to their friends, loved ones. I so much appreciate you. May God bless you abundantly. In fact, take my flowers. I really appreciate you. So meet me in brief. Wow. Mrs. Nosro Oyedele, the Nigeria, Habu from Lagos, Ikorodu, Lagos. Thank you, everyone. I'm so excited to have you all. Please kindly share this link with your friends and loved ones, aunties, sisters, and senator colleagues, so that all of them can benefit from this call. So meet me. My name is Alimat Olubukola Jimo. I'm a professional nurse midwife, born into medicine, or let me just say nursing. I've been exposed to this earth line of a thing at a very tender age because my dad is a doctor. Having worked with various healthcare organizations, he managed to establish his own private practice. So with this has exposed me to meeting a lot of moms, men, women, dealing with their challenges and teaching them how to overcome it. And personally, I've worked across all healthcare settings, from private to teaching hospitals to primary healthcare centers, just name it. That is why I feel I'm in the best position to teach you how you can overcome pain in breastfeeding. Having helped and continue, as well as I still help moms and moms to be to overcome any form of challenges before, during, and after pregnancy. Averagely, I've worked with over 500 moms, over 500 homes, and helping them to manage and overcome all any form of challenges that they are having, either in pregnancy or after pregnancy. I'm also the founder of the Midwife Next Door, where I empower moms and moms-to-be with the right knowledge, skills, and attitude to make them have a stress-free breastfeeding and pregnancy journey. So I'm a wife and a super mom. That's all about me. Thank you. So who is this class for? You may want to wonder that. Is this class for me? Yes, it is for you, because this class is specifically designed to suit pregnant moms, breastfeeding moms, and aspiring moms to be. And within 1 hour that I'll be talking with us, I would like us to take note of every point that I'll be making today. Kindly share out this link, this Zoom link, with your loved ones so that they too can benefit from this webinar. Trust me, it is value-packed. So now let's begin. 7 out of 10 breastfeeding moms experience one or all of these challenges, such as low milk supply, sore nipples, latching issues, breast engorgement, just name it. Imagine having to deal with the stress of childbirth, either it was through vaginal birth or through CS, and still worried about whether your baby is getting enough milk, or you're also dealing with breast pain. It can be mentally exhausting. Like, Very exhausting, trust me. Has anyone experienced this before? Kindly put it in the comment section. Let me know how you have been able to overcome it. And if you have not overcome it, let me know as well. At the end of this class, I want you to know your nipple type and possible challenges that may come with it. You should be able to understand the following breastfeeding challenges, such as sore nipples, low milk supply, breast engorgement, and latching issues. You should also be able to master the art of latching and positioning your baby to breast properly. Also, you should be able to know the home remedies that you can do or you can take, precautionary measures that you can do for managing hormone breastfeeding challenges. Because even if you say you want to go to the hospital, you should be able to manage some things, basic things yourself before you go to the hospital. Because I've come to realize that a lot of moms, even if you go to the hospital that you are facing these breastfeeding challenges, we will still teach you the basic I'll be talking about today. So after this, I will be sharing a free resource with you, and there will also be time for questions too. So let's dive in properly. Do you believe that breastfeeding is a skill, even though God gave us our breasts? Yes or yes? Can someone just put it in the comment section so that I will know I'm not all alone on this call? Thank you, Saoma Habu. I really appreciate it. It's a skill, even though we need to learn it. Thank you very much. Breastfeeding is actually a skill, even though God gave us. He blessed us with it. Most of us believe that when you have a breast, naturally you should be able to breastfeed your baby. Like, I mean, having a breast, how is it possible for you not to know how to breastfeed your baby? Yes, trust me, it is possible, especially if you have some concerns about your body type, which I will talk about later. So number one thing is that there is something we call mother-led attachment. During this process, you are the one, as a mother, you are the one teaching your baby how to latch on your nipple. You are the one teaching your baby to breastfeed from you. But there is another one that is baby-led attachment. This one, in fact, it's so. If your baby is the one teaching you how to position his mouth to your breast, that's the best part. It will make you to have confidence that you deserve on this breastfeeding journey. So I always love to teach mom that breastfeeding, like we talk about, is something that you and your baby needs to learn from. You either teach your baby or your baby teach you. So another thing is nipple type. There are different types of nipple. I'll just mention some common ones, which are the prominent type, the flat nipple, and the inverted nipple. You see all these nipple types, there are some things that nipple type, a person with nipple type that is prominent will do for free, that a person with inverted nipple will not do it for free because of the shape of that nipple. That nipple is prominent, it is showing out, it is pointing out, compared to someone that has flat nipple. Such people in that category need to learn how to breastfeed their baby. Although having this kind of nipple, different type of nipple shouldn't stop us from being able to breastfeed our baby appropriately. But if you don't know how to do it, you don't know it. That is it. Another factor is breast size. You can't compare someone with small breast and someone that has big breast. The way someone that has small breast will position a baby conveniently, or I'm not trying to sideline those with big breast. The way the person with small breast will position the baby will be different from the way someone with big breast will position the baby. because it will require you to support that your breast so that the entire breast will not be covering the baby's nose or even covering the entire face. So before we dive into what we are really into today is, can anybody tell me the kind of breast challenges that most moms face during the course of breastfeeding? The kind of challenges that most moms face during the course of breastfeeding. Oh, beautiful. Wow. Yes, yes, you are right, Mrs. Adewale, latch issues. Yes, yes. A lot of moms face this. Thank you very much, Mrs. Nosra, Mrs. Ablasis Mariam. Thank you. Thank you very much. Yeah, you are right. Common breastfeeding challenges are latch issues, sore nipple, low milk supply, nipple pain, and a lot more, mastitis, breast engorgement, and so on. So before I begin, I will be starting with latch issues. When we talk about latch issues, like I said earlier, that breastfeeding is supposed to come naturally. But when we don't know how to position our baby to breast, that is when we have breastfeeding challenges. So when we talk about latch issues means that your baby is actually positioning his mouth to the breast, but not the breast, the nipple is not reaching the spot, the palate of your baby that will trigger a form of sucking or swallowing reflex. And even if it will trigger it, it's going to be shallow. Like this picture, this shallow latch. Indirectly, the nipple of the mother is inside the baby's mouth, but the nipple, the entire breast is not on the baby's, inside the baby's mouth. If you compare these two parts, the shallow latch and the deep latch. And when the baby is latching on the nipple, the baby is actually sucking the nipple and it's going to be painful. In fact, breastfeeding is not established because the mother will not be comfortable. Majority of all of these breastfeeding struggles are caused by poor latching. Let's just take note. All of them, from sore nipple to breast engorgement to low milk supply, all of them, most of them are caused by poor latching. And when we talk about poor latching, when we are talking about poor latching, what could be the cause of this poor latching that we're talking about? Number one is prematurity, poor positioning of the baby to breast, tongue tie, breast engorgement, and lots more. So prematurity, usually baby less than 32 weeks of pregnancy are being referred to as premature babies. And by this time, there is absence of sucking and swallowing reflex in them, which makes them not to be able to latch on their mother's nipple appropriately. That is why babies that are born premature, they are usually fed with maybe syringes or feeding tube in the hospitals. But some are maybe very strong that even you can see a 32 weeks of baby, very active and strong compared to a full-term baby. So this thing is kind of dicey. So poor positioning. Let's take a look at this picture. Number one thing I want us to take note in this is the nursing pillow. A lot of us believe that when we have a nursing pillow, it's just like a platform for us to put our baby onto. The way they design this nursing pillow is that nursing pillow should serve as a support for us when we are breastfeeding, not to be like a platform or like a tray for us to set our baby on. So if we take this nursing pillow as a form of support, we are going to enjoy this act of breastfeeding because the baby will be coming closer to us and not us going to the baby. Because if you are the one taking your body to the baby, it's going to cause you back pain, a lot of neck strain, and a lot of that. Even your baby is not going to be comfortable. Because, for instance, if your breast is something that is small, kind of big, it may be covering the baby's nose and affecting the baby's breathing pattern as well. So we really need to learn how to position our baby appropriately. When we do this, there's going to be shallow latch. The baby will, there's not going to be shallow latch, and there's going to be deep latch. The nipple will not be painful. The baby will feel secure, and there will be good milk transfer. Another factor causing this poor latching is tongue tie. If you take a look at these two pictures, you can see this is the tongue tie A, and this is another tongue tie B. There is like a bridge tying the tongue down to the mouth, making the tongue not to be free compared to someone without tongue tie. So a baby with this, their voice, for you to even know, the quick way for you to know is that their voice will not be, it will not come out well compared to a baby that doesn't have tongue tie. For instance, a baby that has tongue tie may be doing like, wah, wah, but baby that does not have tongue tie, the shout will be very shout and sharp. So a baby with that tongue tie, it will be because the tongue of that baby with no tongue tie is not being tied down, is not being captivated, is not being on captive. So the baby will be able to position the tongue appropriately on the mother's nipple compared to baby with that with tongue tie. This is how the normal mouth of a baby should look like. You can see the shape, like a V shape. That is why when they discover that your baby is having tongue tie in the hospital, they either try to use the end to maneuver it, or try to do, there's some that they do surgical removal, or to just small cuts on that frenulum that is tying the baby's tongue down. So another cause of poor latching is breast engorgement. I mean, like when a breast is not expressing its milk, it will become overloaded. And when it becomes overloaded, it is full and the nipple will not be prominent. A nipple that is not prominent, it will not make breastfeeding to be comfortable for the baby it will not make it comfortable for the baby to latch on that kind of nipple. Let's take a look at a normal nipple and an engorged nipple. You can see the normal nipple is prominent, and an engorged one, you hardly see the nipple being prominent because the engorged milk has covered the entire the side of that nipple, making it difficult for the baby to latch on. Even though engorgement is very common in the early weeks after childbirth, this is because your baby is just mastering the act of breastfeeding. So for you to be able to overcome this, you need to continuously express your milk, even if your baby is not latching on it, even if your baby is not sucking on that breast at that particular time. You need to continue to express it and make sure that you are making it a breast per feeding session. Not like you give right breast to the baby now. During the next session, you still want to give the baby the right breast. No, you have to give the left breast. You alternate it. When you give the right breast now, you give the left breast during another feeding session. So why does all of this latching or breathing matters? It has benefits to you and to your baby, but I'll be taking the benefits of a good latch on the baby first. A good latch helps the baby to get enough milk during feeding. Another thing is that the baby gets all the important nutrients for proper growth. I can remember a mom talking about the baby of a 2-month-old baby not getting, she is worried that the baby is not getting enough milk, the baby is not gaining weight. So during the course of my conversation with her, we realized that I asked her, how long do you put your baby to breast? She said, after 5 minutes. The baby, I will just remove it from her mouth now. I don't take long from breast for her to feed on the breast. I told her that you are the one not giving your baby the necessary nutrients that is needed for her growth, that will make her to gain weight. This is because the fore milk that will come out is basically water. Majority of them is water. And when the baby is only drinking water, is only sucking on water, the baby will just be urinated, it will just be passing the urine, no nutrients. Because it is after you are well relaxed, the fore milk comes out, then the hind milk, which contains the energy-giving food, all the necessary nutrients are at the back. If you relax, if you are well relaxed, that is when your baby will be able to get all the required breast milk. Because when we talk about breast milk, it's not only about I'm giving my baby to breast. Are you giving the baby the required nutrients that your baby needs? Because if you are not giving your baby the required nutrients, definitely your baby will not gain weight. And this breast milk, like we said, we all know that the breast milk is very important for baby growth and development. So another reason why a good latch is very important is that it reduces the chances of the baby swallowing extra air and thereby prevents stomach discomfort like colic, like colic. Because this is because when the baby's mouth is well attached to your nipple, there is no way the baby will be sucking air inside. Even if the baby is going to suckle air, it's going to be minimal compared to a baby that is latching on only the nipple. Like you took carbonated drink that is filled with that is gassy, you can't compare it with someone that just took only water, that take only water. That kind of person will be able to eat well to the brim compared to someone that has taken carbonated drink. The amount of food the person will eat will be small. So another reason why good latch is very important is that it aids in mouth development. Like your baby's mouth will be developing as appropriate. So the benefit to the mother, when your baby latches on your nipple well, it causes less pain. It makes the breast to be able to produce enough milk, which will prevent low milk supply. It also builds emotional connection. Like you are breastfeeding your baby is looking at you. You too, you are looking at the baby. There's this kind of connection between, like a bond between you and your baby that you will love. Let's quickly digress a bit. Imagine if a baby has tooth and you are carried away. Your baby will try to force you back to the realm of that breastfeeding by biting. But if you are looking at that your baby at that particular time, before the baby even bites you, you would have noticed that you want to do something wrong. Go, don't do it. So it's a form of connection. There is a form of connection between the mother and the baby. Another reason why, and lastly, why good latch matters is that it reduces the risk of breast problems like engorgement and mastitis. Because as you continue to breastfeed your baby, the milk in your breast is being expressed from time to time. You will be able to, enough milk will be produced, and that milk is not going to be overfilled up. It's not going to be overfilled up, and it's not going to cause an engorgement. Because during the course of engorgement, when bacteria fed on the milk, that is when mastitis will set in. Then how to achieve all of this? So before I continue, kindly reshare this Zoom link to your friend, your loved ones, so that all of them can benefit from what I'm sharing with you this evening. So how to achieve this? you need to assume a position that is very comfortable for you and your baby. A typical African mom believes that it's only when the baby is crying that the baby is hungry. Meanwhile, the cry of a baby can be as a result of several factors, like the baby is uncomfortable, maybe because of the temperature, the weather condition, or maybe the baby, the diaper is wet, the way they wrap the baby doesn't find it comfortable. It can be a whole lot. Ensure that your baby is relaxed. Like I said, a typical African mom believes that it's only when the baby is crying that the baby is hungry. Meanwhile, a newborn baby should feed at least 2 to 3 hours in the next like 8 to 12 times in 24 hours. But if you don't allow your baby to be relaxed, the baby is crying, you won't be able to achieve a good and comfortable breastfeeding position or a good latch. So in order for you to do this, it's for you to be able to achieve this, it's for you to watch for your baby cue signs. Babies don't just cry, they don't just begin to cry unnecessarily. They have cue signs that mothers should learn. Examples are, your baby can be trying to put his or her mouth in his or her hand in his mouth. People will be like, the baby is just like sucking, the baby wants to be sucking his thumb. Meanwhile, the baby is hungry. Or the baby is just trying to, look sideways, any small touch to the baby's cheek, the baby is looking sideways for, where is this breast? Where is my mother's breast? Because if you watch for these signs, it won't catch us unaware. Or if you time your baby that my baby fed at 10 a.m., the next feeding should be around 12 or 12:30 if you are a new mom. But if you are relaxed, that it is when your baby is irritable, the baby is crying, that you want to breastfeed the baby will not be comfortable. That is when you'll be struggling with, how do I latch this baby? How do I latch this baby on this nipple? Or am I doing this correctly? I'm even tired, I'm exhausted. But if you have watched for your baby cue signs, it will be easier for you to achieve a very good latch. So let's take a moment to watch this video.
Close along your forearm so that her chest is touching yours. Remember to bring your baby to your breast and not your breast to your baby. Bring your baby's nose directly opposite your nipple. As your baby tips her head back, her top lip brushes over your nipple. This encourages her to open her mouth wide. When her mouth is wide open, hug your baby to your breast and she can take your breast into her mouth with her chin leading. When your baby attaches well, she will have a large mouthful of breast in her mouth and your nipple will be positioned far back in her mouth to close along your forearm so that your breast into her mouth with her chin leading. When your baby attaches well, she will have a large mouthful of breast in her mouth and your nipple will be positioned far back in her mouth towards her soft palate. Breastfeeding will more likely feel comfortable and she can get the milk she needs. So here is how it will look to you. Bring your baby's nose directly opposite your nipple. Allow your baby's head to tip back. As it does, her top lip will brush over your nipple. This encourages her to open her mouth wide. Sometimes it can take a few goes to get the timing right, so you can encourage her to open her mouth wide again by brushing your nipple over her top lip. When her mouth is open wide, quickly hug her onto your breast, directing your nipple towards the roof of her mouth. This helps achieve a deep attachment where your nipple is deep inside your baby's mouth towards her soft palate. When your baby is attached well to your breast, her chin will be touching your breast and her nose is clear or only just touching your breast. Her lips are flanged out, not sucked in. There will be more of your areola showing above your baby's top lip as compared to her lower lip. You also know you have good attachment if there is no pain, although it is common for some mums in the early weeks to feel some nipple pain that ceases after the initial attachment. At the start of the breastfeed, your baby's sucks will be fast and shallow as she gets the milk flowing by triggering the reflex that allows the milk to flow. After this, she will do groups of deeper, slower suck and swallows. Swallowing can be identified by a soft tick sound and also by a pause in her chin when it drops down to its lowest position when she has a mouthful of milk. The longer the pause in her chin, the bigger the mouthful. Rest periods between sucking are a normal part of breastfeeding too. As the breastfeed continues, the groups of sucks and swallows gradually become shorter and the rest periods longer. Most of the time, a baby will come off on her own accord when she is finished with that breast. Close along your forearm.
I believe we were able to get one or two things from that video. Please let me know in the comment section. Did you get value from that video? Yeah, good. So there is a particular part I want to talk about when she was talking about your baby will come out of the breast by he or herself. A lot of mom make this as problem, or let me say this mistake, but let me use that word. A lot of mom make this mistake of when the baby wants to come off the breast, or they want to intentionally take the baby off the breast, because some baby can be very funny that you will think they are sleeping, but they are not sleeping. So during this course, you want to, as a mom, you'll be like, my baby is sleeping. Let me just remove the breast from the baby's mouth like that. Boom. If you do this, you are indirectly causing potential sore nipples to yourself, because the way God is just so great. Like the way he created this latch, when the baby latches on the breast, there is a vacuum. So this vacuum has to be released. There is a function that you need to release before you pull out your baby from the breast. That is if you are the one that wants to remove the baby from the breast. Maybe you have certain things to attend to. Do you need to release this suction from a baby's mouth before you let your baby come out of the breast? If you are the one that wants to bring your baby, you want your baby to come off the breast. So that's just that one. So a proper latch should look like this. You can take note from that video is that woman is not supporting her breast. This is because she was able to master the art of proper latch. A lot of people make the mistake of, should I support my baby's nipple? Should I support my breast or I should not? I will advise that you support your breast. Like this picture that I'm talking about. This is because when you support your breast, it is indirectly supporting your breast. Your hand is indirectly supporting your baby's jaw under your breast. That the forehand below underneath your breast is supporting that breast. And that your thumb is guiding your breast from touching or closing the nose of your baby. So a proper latch should look like this. The entire nipple should be in the baby's mouth. The entire breast should be in the baby's mouth. From that, when we look at our nipple, the nipple is at the center. There is either a black for some. There is some people, their areola is lighter. That areola part should be in the baby's mouth, not outside. That is a typical proper latch. So now let's talk about the second challenges that most moms face and how they can overcome it. is low milk supply. And the contributing factors to this are infrequent feeding, like I've mentioned earlier, that a typical African moms will think that only when the baby cries, that is when the baby is hungry. No, you need to time your baby. As they grow, when they reach like 3 months and above, their feeding time reduces. Second one is poor latching, like I've mentioned before. Hormonal imbalance. This can be as a result of thyroid disorders or reproductive hormones disorders. Another one is poor nutrition. If you are eating well, that is when your body will be able to produce enough milk for your body, for your baby. And the last one is stress. When we are stressed, there is a release of an hormone called cortisol. This hormone is an enemy of breast milk production. So we need to try as much as possible as a mom to avoid stress. We should manage our stress level very well. It is very important. Then how you can improve your breast milk supply. Number one is you should help your baby latch properly. We have talked about that one earlier. If you need this video, I can send it to you after the class. Just call my attention to it if you need this video. The second point is that you should eat healthy foods. Cut down sugar intake. Make smoothies and milkshakes your best friends instead of carbonated drinks. I'll give you my free ebook on these smoothies and milkshakes at the end of this session. Number 4 is you should stay hydrated. Drink plenty of water. Rest well. It is super, super important. Breastfeed your baby on demand. I've talked about this. So number 3, another breastfeeding challenges that most moms face is nipple pain or sore nipple. And the causes are poor latching, sensitive nipples. There's some nipples that their skin is very sensitive, that when the baby's mouth is on their nipple, during the process of breastfeeding, you can see in that video that the nipple is touching the roof of the baby's mouth. A sensitive nipple, when that nipple is touching the roof of the baby's mouth, if the jaw is one that is kind of a bit sharp, it can be that kind of a friction can cause the nipple to be peeling out, indirectly causing sore nipple. The third point is underlying issues like thrush. It could be from a thrush from your baby or a thrush from you transferring it to your baby. A thrush from a baby should look like this. When you wipe out the milk, excess milk in your baby's mouth after feeding, it shouldn't clean off if it is a thrush. But if it is just normal breast milk, it will clean off instantly because it will be readily absorbed into the baby's body. So solution to sore nipple is that you should ensure proper latching of your baby to breast. You could see that when I was talking on the my second or third slide, that I said majority of all these breastfeeding struggles is basically due to poor latching. So if you latch your baby properly, sore nipple will be minimal. Even if it will come, it's going to be reduced. And how can this be achieved is that if you are during the course of your breastfeeding, if you notice that you are having nipple pain, you can change your position. Change your breastfeeding position, or you change that nipple and that particular breast. If you are using the right breast, you can change to left breast. Just find a comfortable position for yourself. Another one is you should assume comfortable breastfeeding position. Breastfeeding is not that you should sit on the chair. It's not compulsory that for you to sit only on the chair. You can you can assume a position that is perfectly comfortable for you and your baby. If you are comfortable and your baby is comfortable and you are able to position your baby to breast perfectly, you are good to go. There is no standard way that this is how you should position your baby to breast. But however, if you are doing some positioning, you need to be careful, especially if you are using side lying position. If your baby has not reached 3 months, I won't advise that you do this. Because if you are not careful, the nipple may enter your baby's nose. Instead of your baby to be sucking on the nipple, you are feeding the nose with the breast milk, which can be catastrophic. So we pray that we won't experience such. So these are different types of breastfeeding position we can assume. We can assume a laid back nursing position, cradle hold, cross cradle hold, football hold, if you are a twin mom, or a single mom too can do this. So another way you can actually ease sore nipple is by applying Lalolin nipple cream. This nipple cream is designed to soothe and protect sore nipples, and it is safe for baby. But I will advise that if you apply this nipple cream, you should wipe it off if you want to let your baby to latch on that nipple. You can as well use shea butter or coconut oil, or apply breast milk. You should wipe it off before each feeding. We don't want a situation whereby your baby will be latching on the shea butter. Meanwhile, this shea butter is not appropriate for a baby less than 6 months, even for greater than a baby that is more than 6 months safe. So we don't want this. So another way you can ease sore nipple is by freeing the nipples. Wear loose clothing. And the last one is you can wash the nipples with saline solution rinse. Some sore nipple can be so severe that it will look like this picture. So for this kind of sore nipple, you can do this saline solution rinse. Then how do you do this? You get a salt and a warm water. That warm water, it should be a hot water that has come to cool down. Then you either take a cotton wool and dip it inside that water that you have put salt inside, and use it to wipe that your particular sore nipple site, or you submerge your nipple in the solution for like 5 minutes. You shouldn't let it take so long. Then you apply a nipple cream after this solution rinse. Lastly, you should consult a breastfeeding counselor. They will be able to guide you through, and they will also know the kind of problem that you are having. They will be able to do proper medical assessment and evaluation that will allow you to be able to breastfeed your baby effectively. So a lot of moms face these challenges during breastfeeding. And here I will be talking about how you can overcome it. There is no perfect mom in the world. There is no perfect mom. There is no place they are giving awards to. You have a first class in breastfeeding, or you have a first class in motherhood. There is nobody that has won that award. So this feeling of overwhelmed, mothers tend to have this feeling of being overwhelmed with all this motherhood journey as a whole. Mom's guilt, the feeling of not doing enough. Am I doing enough for my baby? Especially if you have a toddler, you start feeling guilt that you are the one causing a problem for yourself. No, it's just a natural process. Every mom has passed through this stage, and you too, you will overcome it. Sleep deprivation, a lot of moms have this. A lot of moms that have the experience it. There is no mom that you count. If you count 1, 2, 3 to 10, that the mom will say, no, I get 6 to 8 hours of sleep every day. It's not possible, except you are able to manage that sleep deprivation very well. And to do this, you need to express your feelings and seek support from spouse, friends, or professionals. I always tell my people that they should make use of the help, any help available at all, make use of it. If you see someone that just come and greet you and you feel that you need help, please hold my baby for me. I need to quickly do this. Take breaks. Be kind to yourself. Take yourself on treats. Join breastfeeding support groups. I've created one for you, the BMX class, and I'll continue to provide you with resources and all the necessary information that will make you scale through motherhood, and for you to be able to gain confidence in motherhood. Because I believe and I have this greatest desire that every mom deserves to thrive. when they are nurturing their little ones. No mom deserve to have suicidal ideation because of motherhood. Even though there are some moms, a lot of women are undergoing this. Postpartum depression is real. It is very, very real. And we need to manage ourselves well so that we can be a good mom, because it's an healthy mom that will raise an healthy baby and an healthy nation. So thank you for your rapt attention. We have come to the end of this class. Question time. If you get value, let me know in the comment section. If there is something you want me to talk about, let me know in the comment section. Thank you very much. Thank you very, very much. So the number one question. Please kindly drop all your feedback also in the class so that those that missed out will know that they really miss a lot of things. Even though I'll be sharing the replay of this video of this class, but not so soon. So the first question said, what will be your advice for a mother who has who with one breast bigger than the other one after a few weeks of birth? Like I said earlier, during the course of your breastfeeding, it should be a breast per feeding session. If your baby latches on right breast during the first feeding, the second breast should be during the second feeding session, it should be on the left second breast, so that the milk production will be evenly, not one-sided. Because we have come to realize that if you continue to breastfeed from a particular part of the breast, from a particular part, maybe you are using the right breast and you are neglecting the left breast, we have come to realize that you are telling that left breast to stop milk production, and you are telling the right breast to continue milk production. So such a mother should continue to ensure that you are using the two breasts that God gave you to feed your baby. So another question is, how do you know if your baby is filled up? Number one is either your baby come off the breastfeeding, the act of breastfeeding by himself or herself, or you feel that your breast, if you are very familiar with your breast may be filled up before you're feeding, but you realize that when you are done with feeding, your breast will be as if it's flat, that there is no milk inside again. So these are the two ways. Is either your baby comes off the breast himself or herself, or you realize that it's like your breast that was filled up initially is now flattened out. I hope I've answered your question, Mrs. Monsurat. Boy, even though there is no scientific back up with that, maybe that a boy child feeds often than the girl child. I don't think that is true though, but let your baby feed on it. It's a good sign that your baby is eating well. It's now left for you to eat well as well, so that it will commensurate with what your body is producing. Mr. or Mrs. Abu, you said your baby cries most of the time, like 2 hours at a stretch, why it sucks well and no fever. And have you tried to check maybe it's because of the diaper? It may be because of the diaper problem, or it may be because of the weather. It may be because of the clothing. It may be because maybe there's something, maybe the stomach, there is a stomach discomfort. I think you can chat me up privately so that we can discuss more on that. But Mrs. Raimat, do you think your baby is actually latching properly on your nipple? If your baby is latching properly, like you feel that the entire nipple is inside the baby's mouth, you may not necessarily worry about that. Scissors, no scissors way. Oh, don't use scissors. Scissors is not okay. Let me even turn on my camera. This is scissors type, like this. If you are doing scissors type, we are not doing any, we are not doing what we want, we are not supporting the breast like we want to do. You are supporting a breast, not nipple. If you are doing scissors type like this, you are putting your baby like this, you are not supporting the breast. But if you do it like this is your forehand, the 4 fingers, 1, 2, 3, 4. They are under the breast, and this your thumb is the one supporting, preventing the breast from covering the baby's nose. So no scissors type is the C way that is appropriate. The reason why babies may cough during breastfeeding is either the breast milk is not entering where it's supposed to enter. The breast milk should enter through the esophagus, but when it touches, because the baby are still developing, so during it may be because of your positioning. So if the little milk is trying to enter the maybe the trachea, which is the airway passage, the reflex action is that the baby should cough just like an adult. When you are eating and you are at the same time you are talking, you will see that instead of the way God designs all is that when we are eating, that trachea will be slightly closed. During the course of our chewing, the chewing will be the one to close that part. So all the food will be entering through the esophagus. But if you are eating and you are talking, a bit of it will enter into your trachea. It may not even enter the trachea. It may be at the entrance of that trachea that it will enter. So kindly make sure that you're actually positioning your baby to breast well, and ensure that the nipple, and another thing is that there are some people that they have long nipple. There are some that they have short nipple. If your nipple is too long, it may be causing a form of reflex action for the baby to feel like this thing is too long, entering where it's supposed not to be. So for that kind of baby, you need to try as much as possible to be deeply involved in the breastfeeding, and make sure that you are positioning the baby properly. Excessive cry can be as a result of a lot of things. It could be because of the weather condition. It could be because of stomach discomfort. It could be because of diaper problem. It could be because of internal body. Maybe the baby is actually feeling pain in particular part. You may need to chat me privately, Mrs. Abu, so that we can talk more on this. I think we have talked about it earlier. Don't worry, I will share the video with you in the group. Yes, it's normal, especially if the baby has a lot of milk in their mouth. So because they cannot swallow the everything due to their small esophagus, due to their small digestive system, they may need to bring some out before they can swallow, so that they will not swallow excess one. If they attempt to swallow it, it may cause the baby to have some reflex action such as cough, or it may even come out of the baby's nose. So let me also buttress more on that part of milk coming out of the baby's mouth. As soon as you start breastfeeding, like 1 to 2 minutes, the way your baby suck is going to be shallow, like it's not going to be very deep like that. But it is when they are now more relaxed during the course of breastfeeding that you start hearing, some may be making a tick sound, like like you'll be hearing that sound that they are making. That means the milk is much and they are enjoying it. And at the same time, the milk is actually given, the way God creates that esophagus in such a way that there's some reflex action will be preventing excess milk to rush down, to gush down through that pipe. You know, when it's gushed down through the pipe, it may cause them, it may cause harm. But if it is much in the mouth and the baby pour it out, or the baby swallow everything, which is normal. So the breastfeeding, the smoothie resources, the smoothies for milk supply, they are actually a combination of fruits, vegetables, yogurt, milk. That is what smoothies are. They are a blend of all these fruits, natural ingredients. Let me take this for instance. Let me take watermelon smoothie. You can make use of only watermelon, and you can get yogurt of choice, as well as you can add milk to it. Then you can add your chia seed. This chia seed, there are some things that they are known as galactologogues. They help in milk production. There are some fruits that help in milk production. Examples of them are watermelon, banana, cashew nut. A lot of them, they help in milk production. So blending all of these together is what gives us smoothie or milkshake. You can blend banana and watermelon together. You can blend watermelon and pineapple together as a form of smoothie. They are just an healthy way for you to enjoy. They are just like fruit juice. But this one is not juice because they are not sieving out the shaft. You are taking the entire shaft. If you want to make watermelon juice, you can make it by sieving. I mean, after you have blended the watermelon, you can sieve the watermelon. Then that's when you get your juice from. I only lactate on just right hand side breast, while the other does bring little breast milk. Continue to lactate on both breasts. With time, the one that is bringing out little milk will bring out more milk. Because the way God designed our body is that the milk in your body is enough for your baby. So if you're having low milk supply and you have tried all the measures I talked earlier, and it's not working, it may be because of hormonal imbalance. And you need to see an endocrinologist or a breastfeeding counselor. Exactly. Because Mrs. Raima, I think I've answered this. Because the baby is trying to rush this down the throat. And we don't want a situation whereby everything is just brushing down the stomach, inside the stomach like that, and causing problem. So God is just so great and so wonderful in the way He created us. Mentholatum is good. No, don't use rub. And if you are going to use mentholatum, don't use it directly. You can, because mentholator, the way they design the mentholator, it is being prepared is that it is mild compared to using rub. And don't put your baby in place where you have people that are using rub. It causes jaundice. So mentholatum is good. You can use it, but it should be mild and not often. No, it doesn't. Eating too much of fruits and vegetables won't make your baby poo. But some babies can be very funny, especially if they are very sensitive. Example of this is maybe a mother take a lot of beans. Your baby, some babies may be reacting by having gassy stomach. Their stomach will be rumbling because of what the mother ate. So if you notice that it is every time you take fruit and vegetables that your baby actually poo a lot, I think you should watch out for that particular fruit or vegetables that is making your baby to poo more often. It is very okay. It is very Mrs. Monsura. Your baby's suckle every 30 to 45 minutes. It is very okay. And as long as your milk is producing, it is very okay. Let your baby feed. Let your baby, it's not a standard, and that 2 to 3 hours is just like an average time. It's not a standard measurement. Let your baby feed because the metabolic rate of the baby differs. It's just like an adult. Some people, when they eat in the morning, they may not be able to eat anything in the afternoon or at night. It is only after maybe tomorrow, the next day. And there's some people, like, if they eat now, in the next 10 to 15 minutes, they will still be hungry because of their metabolic rate, especially if the person is active. Do you understand? So let your baby just feel 30 to 45 minutes. Let your baby feed as often as they want. But make sure that you are eating well so that it will commensurate with your milk production. Will fruit juice serve the same purpose as milk, as smoothie? Yes and no, depending on the fruit juice you are making. Because if we are using this, if it is not a natural one, we should have it in mind that all these are packaged fruit juice is not 100% natural. It's not from the natural source. Some, majority of them, they add some preservatives, and as well as they add some sugar inside. So the smoothie or fruit juice that you are making at the comfort of your home, if it is, they serve the same purpose as smoothie. Whether it's fruit juice or smoothie, they serve the same purpose. Just as some people does not like taking maybe watermelon shaft or pineapple juice shaft, then you may want to juice it. It's still the same. Just that you can't compare someone that takes smoothie eating with shaft and someone that does not take smoothie that takes fruit juice. Is different. It's just like, let me take this example. When you are taking orange, if you are only sucking out the juice and not eating the shaft, eating the other part of the inside of the orange, that other part contains fiber, which will aid digestion. So taking orange, you are not expected to take only the juice, but some people find it uncomfortable to take that other part inside the orange, which is still fine, but it is advisable that you take it with the parts. Mrs. Raima, I don't understand your question. You said, can excessive air while sucking to make the baby's stomach often? If I want to reframe it in my own term, I will say that you are saying, like, can excessive air cause discomfort for babies? If that is your question, yes. If the baby is swallowing excessive air during the course of swallowing air during the course of breastfeeding, it will cause stomach discomfort. And that is why after you are done with breastfeeding, you should pat your baby to belch, so that all the air that has been trapped inside your stomach will be released out. And indirectly, if you I'm also you will see that baby that are often belch have tendency to have colic, have little chance of having colic, because excess trapped air is what causes colic. So when the stomach is too gassy, that is when the stomach will start rumbling and causing discomfort. Have I answered all questions? I think we have come to the end of this class. If you still have any question to ask me, it is not scientifically proven that when the baby belches on the breast, it will cause breast engorgement. No. Please kindly drop all questions into my DM. Send a private message to me. I won't be able to take any more questions now. Kindly send it now, between now and tomorrow, so that I'll be able to answer all your questions. No more questions after tomorrow, please. And make sure you stay inside that group, because I'm going to load you with a lot of wonderful resources that will make your breastfeeding journey easier. So grab your giveaway, grab my book worth of 2,000 naira for free, 10 yummy lactation smoothie recipe. Kindly grab it now. Thank you, thank you, thank you very much. I appreciate every one of you. God bless you. Please follow us on all social media platforms: Facebook at The Midwife Next Door, Instagram Midwife Next Door, TikTok Midwife Next Door, and LinkedIn Alimat Olubukola Jimon. Thank you so much.